I'm mostly practicing what we would consider to be allopathic medicine or the usual traditional medical practices. But in working with Kendra and developing the brochure that she has put together for integrative approaches to Ehlers-Danlos syndrome, I think she's really highlighted quite a few issues and approaches that can be very, very helpful for people who have both Ehlers-Danlos syndrome and other hypermobility syndromes. So that's what I'd like to talk to you about today. And if you have questions about how these relate to more traditional medical things, I'm more than happy to discuss those to the extent that I know. Okay, so next slide, please. This is the sort of one side of the Integrative Healing brochure. And did you bring those, Kendra? Do you have it?
The previous version, you're all going to get the new versions once they're printed.
Okay, all right, good. And what I'm going to do in the next 45 minutes or so is just go through each of the elements that is on this brochure and talk about some of the evidence behind these various integrative therapies. Next slide, Kendra. And I know that you're going to be having a session on mindfulness, right, immediately following this one?
Yeah, well, we did one yesterday, and then today they're probably
Okay.
me talking about it. I have printouts for John Cobb.
Excellent. Okay. So next slide, please. So patients who have Ehlers-Danlos syndrome and other conditions that involve joint hypermobility have many, many symptoms. Not everybody has all of these symptoms, but they're seen very commonly. And the people who eventually find their way to me usually have at least 5 or 6 of the items on this list. So they include musculoskeletal pain, fatigue is a very common problem, headache and migraine, extremely common, and multiple gastrointestinal issues. One of the most common complaints is brain fog, and it's really interesting. A lot of times you'd think that pain would be like the most serious thing, but when people can't use their brains, it really takes them out. So the fatigue and the brain fog often are the things that people are most desperate to get under control because they really can't do their stuff. They can power through the pain, they can figure out ways to address it, but the fatigue and the brain fog are very big issues. Sensitivities, very, very common to food, chemicals, or other things, and the ADD, ADHD, anxiety and depression. The joint issues are not only the pain, but also instability, so people are at risk of falling because of instability, and particularly in the ankles, often in the hips. Pelvic pain can be very problematic, and they often will report bruising, unusual bruising. Next slide, please. So the comorbid conditions that we see in many of these patients include mast cell disease, and I know we have Dr. Afrin with us this weekend, which is just wonderful because he really is one of the world's experts in this area. The dysautonomia and postural orthostatic tachycardia syndrome have many, many manifestations in multiple different organ systems. The autonomic nervous system involves pretty much every organ system that you can imagine. So if that's not working well, the body's not going to be working well. There is a big overlap with fibromyalgia. Many of my patients have been previously diagnosed with fibromyalgia, and I'm not really sure how to differentiate between fibromyalgia and many of the musculoskeletal complaints that people with Ehlers-Danlos syndrome present. Chronic fatigue syndrome and various autoimmune conditions, and I think there is an overlap between the chronic fatigue and various autoimmune conditions. One of the really interesting things that has just really come to my attention over the last, I would say, year or so are the various autoimmune encephalopathies, or the autoimmune conditions that affect the brain. And those may follow particular infections, like strep infection may lead to an autoimmune condition that you may have heard of called PANDAS. And so those autoimmune conditions can really have a big effect on the way the brain functions and lead to that difficulty with thinking and functioning that I was talking about earlier. Thank you so much. Now, functional gastrointestinal disorders, that word functional can be a loaded word. A lot of times people who've been to doctors, they're told their illnesses are functional, and what that is medical speak for is it's all in your head. That's not what I'm talking about here. I'm talking about the actual function of the GI tract and the fact that the motility of the GI tract is not working properly, or certain valves in the GI tract, like the valve between the esophagus and the stomach, or what we call, there's another valve called the sphincter of Oddi, which regulates control of the gastric juices. That may not be working well. We know of many, many problems with allergies, which is a big overlap with the mast cell disease. And then something which really hasn't been written about that much and explored that much is the connection between these disorders and endocrine conditions. But in my patient population, we see lots and lots of different endocrinopathies, including problems with the thyroid, problems with the adrenal glands, which may be related to the dysautonomia. And there are also, I have a subpopulation of people with growth hormone deficiency. And I think that likely the connection is if people have increased intracranial pressure, which we can have for any of a number of different reasons in Ehlers-Danlos syndrome, the pituitary is very vulnerable under conditions of increased intracranial pressure. The pituitary is sort of our master endocrine gland, and it sits on a very, very fine stalk bathed in the cerebrospinal fluid, and through that very fine stalk that feeds the pituitary, there's one artery and one vein. And so if there's increased pressure in the head, that artery and vein can be compressed, and then that can lead to dysfunction of the pituitary. Yes?
And intracranial hypertension and hypoadrenergia, like autonomic neuropathy, can they coexist in a patient?
So the question is, can we see intracranial hypertension and hypoadrenal? Yeah. So definitely, yep. And it may or may not be directly related to each other, but I've definitely had patients with both of those comorbid conditions. So the pelvic dysfunction is another area. There are many, many reasons for pelvic dysfunction. The pelvic organs are held up by ligaments, and if those ligaments are lax because of the connective tissue problem, then you have a tendency toward prolapse of many of the pelvic organs, including the uterus and the bladder. You can see rectal prolapse. And people can also develop myofascial trigger points in the muscles in the pelvic area, because the muscles are really trying hard to counteract the effects of those lax tendons and ligaments, and so they go into spasm. Right. Yeah, so pelvic congestion syndrome is also a very, very important cause of pelvic pain.
What you were saying about the constant stuff resulting in spasm, is that similar? Do you see that also in patients with TMJ?
Oh, definitely. Yes. Yeah. So this is like a constant thread that you see through patients with